Good morning and welcome to this edition of For the Record. I'm Eric Brown. Today we are continuing our look at VA hospitals and how they are addressing healthcare issues of our precious veterans. Today we'll talk about female veterans and how hospitals are addressing their special concerns. Today's guest knows a lot about these topics. They are Dr. Hernandez and Nurse Sabrina Morris from the Fayetteville VA Medical Center. Now, what is your role here as the nurse here, Sabrina? What do you do as far as helping the ladies feel comfortable here during their stay?
I'm the nurse manager of this program. I came on a year ago. I make sure that we hire nurses that have an interest in women's health. This is a specialty. So we make sure that we're women taking care of women that are specialized in the field. Our registration staff is all women, and some are even veterans. So we have women veterans taking care of women. So just making sure it's a friendly atmosphere and the women are comfortable when they come into the facility.
You mentioned comfortable. Do you think many women really prefer another female health practitioner? Do they feel more comfortable with women?
Yes, they are able to communicate with them more open about their healthcare needs. It's more of a friendly bond, I would say.
Well, you know each other. You know each other, you can identify with each other, and you can, I guess women can share things with you that may feel uncomfortable telling a male doctor. So we need to really boost the female health services in the military hospitals, and I'm glad that the Fayetteville VA Medical Center is doing that in a very powerful way through your program. So let's talk about some of the questions that women might have, like maternity benefits. Does the VA provide that?
Yes, we do. We have a maternity care coordinator. She's a registered nurse, and she coordinates the care in the community for our OB patients, which is about 48% of our population.
Mm-hmm. How does one go about getting a clinical appointment? How long does it take to get that clinical appointment?
Well, they call our main number, and when they call, they'll be sent. If they're not sent to our call center, then they'll be sent to us. And depending on their needs, determines the length of time to get into the appointment. But on average, anywhere for 2 to 4 weeks. We also do same-day appointments.
Okay.
If a female veteran had an emergent need and needed to come in, an RN would triage them on site, and we would then sift for them to the right place.
How are you addressing, I guess, issues affecting rural communities and women who live in those areas? How are you addressing their needs?
We, when it's for GYN services, we do have tele-GYN, and those patients normally go to their C-box, the closed community outpatient center clinics around where they live, and we provide tele-GYN, which is to be a telehealth. And we just started also doing tele-maternity care for those patients as well.
So you really are looking out for women, and I'm sure you provide those gender-specific services that women need, mammograms, prenatal care, pap smears, all those things, because women really look for those things in a hospital. What are these women looking for? What are VA women, veteran women, looking for in their health care?
Well, what is so unique, like Dr. Hernandez said earlier, we are comprehensive. So they can get those things that you just mentioned, mammograms and PAP, but we also do diabetic teaching, hypertension. It's like a one-stop shop. They can come and get everything there, so they don't have to go to another doctor. We meet all of their needs.
Well, that's great, because sometimes people will not get the care because I have to go through so many avenues. But one stop, they get all these services that they need in one place.
What's unique about it is the appointment time, the length of time for our appointments. We do allow our patients an hour when they're new patients, and also annual visit. Within that time, they get to have all their care need and all their needs are met within the same appointment. If they need mental health, is provided during the same visit, as well as pharmacy review of their medication. We have PharmD. We also have the maternity care on board. And we have social worker that can help them with any other needs as well. So plus, we have the clinical team that is able to assist them.
Well, I'm glad to hear that. And many women may be concerned or dealing with trauma. They can get all that here. As far as military experiences might have left them in certain states. So I'm glad to know that there are mental health issues are being addressed as well.
Yes, we have assigned patient care mental health workers to our team.
And I know another issue that a lot of women are concerned about is sexual harassment and sexual assault issues. And if that happens to them, they can come here and get the help they need.
Yes, we do. We have a military sexual trauma coordinator on site, and she's available anytime we need her. She's available by phone or by person. And all our patients that come in with such need, they are assessed by our clinical social worker, and she gets on board as well.
So women need to know this, especially our veteran women. With the population growing, with more women in the military these days, these services need to be in these hospitals, and they need to address the issues that you've talked about. So I'm so glad that the VA Center here in Fayetteville and across North Carolina, you guys are addressing these critical issues for the females, because, you know, the face of the military is changing now, you know, and of course women are a part of it now. So a lot of times people may only deal with issues affecting the males, but we need to bring things up to the 21st century and address the key issues that are affecting the women. And why did you want to be in healthcare? That's another glass ceiling that's being broken these days, that many women are now in healthcare, doctors. So what drove you into this wonderful profession?
I guess it's just, well, I always wanted to be a physician ever since a very young age, and also then wanting to help others and help others in need, and being more towards female veteran, to our women's veteran, or women's in general. The fact that I'm a woman and I can be more of their need and understand more their need and be more compassionate. So I would know, well, I would like, and I think our patients will like the same.
I think they found a great compassionate doctor in you. Now get over to you, Sabrina. Nursing, we know, is a wonderful profession, but there are shortages of nurses across the country. So what made you want to become a nurse?
Well, actually, I was born into a family of nurse midwives, being born in the rural South. So it was something that I just knew I always wanted to do. Very compassionate about it. Been doing it for 22 years, and now being able to serve a female population is just, it's just awesome.
It is awesome. It is awesome. You both are role models for women, young women. A lot of young women, they see people on my program and they always want to know what you ladies do many times, and maybe there are young ladies out there who may want to become doctors or nurses. Well, you're great examples of your professions, and I think this hospital is, I commend the hospital for addressing issues affecting women and women's health, because these issues are very, very important. We know the government is even getting involved on a national, federal level to push bills to support veteran females and their health care issues. So I think it's a great thing. It's a great thing. When patients come here, what do you want them to experience when a female walks through that door into your clinic or into your office? What do you want them to experience at being a female?
A warm, friendly environment, their home away from home, a place where they can come and be relaxed and honest and open and see the transparency in our staff and know that they're getting their needs met.
Now, what can patients do to make your jobs better? I'm going to ask you both, from a nurse's profession and from a doctor's profession. First of all, as a nurse, what can patients do to ensure that you can do your job better?
If they bring their medications with them, we will interview them about their past medical history, and if they're just open and honest with us, we can get them where they need it, directed in the right route.
I think they see you guys as ladies, as friends, and as a family, and they're more open to share things with their doctors and nurses. Now, Dr. Hernandez, I mean, what do you want patients to do to make your job better? We have a responsibility too when we see our doctors.
Right. Well, as patient, as a provider, I make the patient kind of be ownership for their own health, and having them recognize what they have and how they can better things or treat themselves, or be able to put their trust in the provider, that the provider wants the best for them. Once they open up and they put the trust on us, we're able to help them in a better way. And it goes for both ways. It's healthcare, it's both ways, and especially what we do as a PAC model, we provide so many resources for the patient during that visit. And when they're open and they're honest and they're allowing us to help them, they walk out of here with all their needs being met.
I think doctors want us to ask intelligent questions, to know what's going on with our own bodies, to research. We can come back and talk more about women's health and how VA hospitals are addressing those key issues with us. Don't you go anywhere. Good morning and welcome back to the program. Today we're discussing female veterans and their health issues and how the Fayetteville VA Medical Center is addressing those issues. And today's guests are Dr. Hernandez and Nurse Sabrina Morris. We welcome you back to the program. Let's talk about how the hospital is accommodating all of these wonderful ladies.
Our clinic have a separate entrance from the rest of the facility, and we have a separate waiting area as well. Our medical support assistant, they are behind a counter, but there's no barrier between them, so it's a very friendly environment to our patients. And our nurses, clinical staff do come to the waiting area to greet our female veterans and bring them back for their clinical appointments.
So it's a family atmosphere. They feel right at home.
Yes.
So that's a great thing. I also understand you have a female chaplain on staff.
Yes.
That's unique.
Yes, very unique. She came on board about 2 to 3 weeks ago, and each week we have a spiritual group where the females can come and discuss they get their holistic needs met and discuss their spiritual needs one-on-one with the chaplain, and it's a great interactive group.
Well, studies do reveal that people with a spirituality, somehow they can put that with their health needs, and it sometimes can improve their health. Yeah. So I think the chaplaincy is a very good idea, and a female chaplain. So this is kind of like an entire female-run service, in a sense.
Yes.
That's great. That's great. Now I know you mentioned during the break, you operate a primary care issue each month. You deal with a new primary care issue. Can you elaborate more on that?
Yes. We are part of an initiative from our visit in Durham. Each month we focus on a healthcare topic. For February we did the Wear Red campaign where we had over 100 participants. Actually had a fashion show on our runway here at our new HCC. October's coming up, so we'll be doing our breast cancer campaign. We'll have a Wear Pink Go Live campaign where we have speakers that are coming in, and we'll have a women's health symposium. This gives our veterans time to interact with our nurses. They can educate them about various issues, and they get a more one-on-one relaxed feel with the nurses outside of the clinical setting. And this is how they get their education. Yeah.
You mentioned October. As we know, February is Heart Health Month, and we know that women now experience heart conditions like men. So what should women remember about healthy hearts?
Women are a little bit more unique than men. When they present, their chest pains are usually more epigastric, and Dr. Hernandez can step in with this. So we teach them about those symptoms, not to ignore jaw pain, back pain, or stomach pain, because women, we're a little unique in nature.
You are very unique.
So we teach them how to focus on that, and the main focus that we tell them is not to ignore, to call 911 if they're experiencing symptoms that are not going away or not being relieved, to get emergency medical assistance fast.
And cut down the stress. I think we all are in such a hustle now. Sometimes stress can cause some of these issues too, can they not, doctor? Stress.
Yes, it's true. We do have same-day appointment or same-day visit when the patient comes in, and they experience any of those symptoms or anything, we do evaluate patients, and we have all the other resources, whether it is medical or mental health, and our nurses are great in triaging those patients, identifying any of those symptoms or signs.
And you mentioned October. We know October is National Breast Cancer Awareness Month.
Yes.
So what should women remember about breast cancer, and I mean, how often should they get mammograms and all this stuff we hear in the news?
Our mammogram, we do follow either guidelines, even though the VA do follow the national guidelines every 2 years after the age of 50. The radiology guidelines every year after the age of 40. So we do discuss both guidelines with the patient, and we allow the patient to make, again, their own health decision. And we do emphasize on their past medical history as well as their family history in making those decisions. So we guide them through how often they should have their mammogram, but they are able to get their mammogram done here in the same facility. They don't have to travel anywhere. It is by appointment. All their x-rays they can get done the same day. And their pap smear as well is done during the visit, annual visit, or first visit.
And it's important for women to get these tests. I mean, we men, we need to get our prostates checked. Our wives tell us to do so. So men need to encourage their wives to get these mammograms. And, you know, we all need to look out for each other because health is so important.
Correct.
So very, very important. So we encourage women to contact, veteran women to contact their local VA hospitals and find out about the wonderful medical services they have just for you. Again, let's go over some of the services you provide here at the Fayetteville VA Medical Center, specifically for women.
One of the services that I want to make emphasis is maternity care coordinator, is a registered nurse, and she coordinates the care for our patients in the community. We do have about 48% of our female veterans that are within the childbearing age, and we are currently getting about, I would say, 14 to 16 positive pregnancy tests every month, which is a pretty high number. We do not do OB care, but we do do the initial visit with their positive pregnancy tests, and we send them through non-VA care, community care, into the community. Our maternity care coordinator, she coordinates the care between those patients and the community OBGYN, and also bring them back to us by making phone calls every other month during their pregnancy and during their postpartum time as well. And we do have currently just started a lactation group composed it's run by the maternity care coordinator as well as the clinical social worker, mental health social worker, to screen for those postpartum depression as well and catch them early.
That's very important. I hear in the news a lot of women do go through that after they have a baby. And it is a change. I mean, it's a change that only a woman knows. Let's get back to prenatal care. That's vital for women to get the proper prenatal care. As a nurse, what would you tell women to do?
To have their regular checkups, make sure they take their vitamins, they speak with their doctor, and when they come to us, we do have, like she said, the maternity care coordinator that does that assessment, but screening and early detection is the key.
The key. Any health advice for any of us, since you both are medical professionals? What should we all do to maintain good health? What can we do? I'm going to ask each of you that. Dr. Hernandez, you first.
Healthy eating and
Healthy eating.
keeping a healthy weight. It's key to health. And also, of course, maintaining your health screening, mammogram, pap smear, all those gender-specific screening. Female have more screening than men, colonoscopy as well. Maintaining all those up to date we'll be able to get illnesses or chronic disease, catch them early. And of course, the annual visit with a provider as well. And don't wait until the symptoms are there, overwhelming to be assessed by a provider. And I say we do have same date, and our clinical staff is very friendly and very accessible, and we take care of our patient on the same day.
Sabrina, coming from a nurse's perspective?
We teach that it's a healthy choice. It's a lifestyle habit. Just like you choose to maybe go to McDonald's or not, you choose to live healthy, live heart healthy. Listen to your body. Listen to what your body's telling you. Listen to those signs and symptoms, and don't be afraid to ask for help, because we nurses are there to help you every step of the way.
True. We should listen to our bodies. I like that you said that, because a lot of times our bodies are telling us things, but we're not listening, and then those illnesses turn into major problems. And then what is normal blood pressure now? I know it keeps changing. When I was a kid, I thought it was 130. Now they want you to have it, what, under 120? What is the normal range?
American Heart Association guidelines recommends 135 under 80, but again, it's individual specific. It's family driven, genetics, so what's norm for one person might not be the norm for the other. So anything less than 130 over 80 is pretty much normal.
Diabetes is on the rise. We know that's almost an epidemic in this nation. If it could be. What should people do to manage their diabetes? That's very, very important.
Diet is the key in diabetic patient, type 2 diabetes, which is have to do a lot with weight and keeping a healthy weight. And of course, if medications is recommended, taking the medication as prescribed can really keep that diabetes from getting to a complicated state, and also complicating other parts of the body as well.
And then they always tell us to keep note of those cholesterol levels. You know, what's good and bad. I know one of them is bad and one of them is good. Explain to our audience. Good cholesterol versus bad.
It all has also, we have taken into consideration whether the patient is diabetic or hypertensive. There's different levels of cholesterol. If you're diabetic and hypertensive, because you want to keep your bad cholesterol below 70 and hypertension below 100. And if you don't have any of those disease and you just have high cholesterol, healthy diet and healthy weight is very important.
Very, very important. Well, I appreciate you ladies coming on to talk about veterans issues as it relates to women, and also giving all of us healthy tips about wellness and how we all can stay healthy. What do you want women to remember about the women's services here at the hospital?
We are here to help in any way, to assist in any way, not just medical, but also spiritual, as Ms. Morris mentioned. We are here to help, and
everybody maintain their health.
Right.
And it's for veteran women. We appreciate you both for coming on the program. Keep up the great work here at the Veterans Center. And that's all the time we have for this edition of For the Record. Again, support your local VA Medical Center. They are making a difference in the lives of veterans, and we want to keep our veterans happy and healthy. That's all the time we have. We see you back here next time.